Returning now to our COVID-19 coverage. While Ontario is reporting a large jump in case numbers today, there is still some promising news. And our Cynthia Mulligan has been following that for us. Cynthia, what can you tell us?
Well, Janella, on this devastating day in this country, it's overshadowing some welcome good news on the COVID-19 front in this province. New modeling from the Ontario government shows the pandemic appears to have peaked early, thanks to social distancing and proper hand washing. But while it seems to be under control in the community, the battle is waging in long-term care homes. And Premier Doug Ford says it is too early to let our guards down and go back to our normal lives.
We saw new modeling that shows there's some light at the end of the tunnel. The numbers clearly show that the steps we have taken as a province are working, and we can't let our guard down now. This virus remains a clear and present danger.
First, the good news. Provincial modeling is projecting the total number of COVID-19 cases to now come in at less than 20,000. That is significantly lower than the worst-case scenario of 300,000, projected a little over 2 weeks ago, and still far less than the expected 80,000 cases.
These actions are making a big difference, and you need to stay the course and stay strong to save lives.
Community spread is under control and hospitals have not been overwhelmed as feared. But now the bad news, and it is grim. The pandemic is continuing to cut a deadly path through long-term care homes. So far, at least 127 have had outbreaks, with more than 1,300 elderly residents infected and 367 dead, 50% of the province's totals. Lack of personal protective equipment has been a massive problem, and only this week will workers be banned from taking shifts in more than one long-term care home, even though officials have known since SARS that the spread is increased when part-time staff go from home to home. The Premier was asked today if the government should have been better prepared for the crisis.
I take the responsibility from the beginning to end of this pandemic.
Premier Ford warns while there is a light at the end of the tunnel, there is also the threat of a second wave. He's begging people to still heed the restrictions that will remain in place. The government is studying how to gradually ease them, but can't say when that will begin.
Are we talking 2 weeks, 4 weeks, 6 weeks? What are you sensing from what the experts are telling you?
Cynthia, I want, and I am giving people hope, because that's what people want. They want hope. They want certainty in their lives. And I just want people just over the next couple weeks, hang in there. This could bite us in the backside in about 10 seconds. It could come up with a second wave again. There's no one out there that wants to open up the economy more than I do. But we just have to hold off for a bit.
The province will increase its focus on testing in group homes and shelters. The Associate Medical Officer of Health says they hope one day to start random sampling in the wider community to see how many people have been exposed but are asymptomatic. The province is also examining how to restart the healthcare system and reschedule the thousands of surgeries that have been postponed.